use.
1 second. Let me start. Okay, new video.
Okay. If you were to take something out of here, you write it down on our supply sheet so that we have an idea who's using what, and you initial it, what program it's being used for. Okay, and close this door. So you might be asked, especially when you're a clinic assistant, to come in here and go get this for us. And that's where you come and go. So we kind of did, we're on the way of, it's a loop. This is the patient reception area. This is where patients come in that either come in to get their x-rays taken with you, or they'll come in with to get their teeth cleaned with the hygiene students. So we don't call it a waiting room, we call it a reception area. So this is where they come in and they check in and they wait until the student comes in and takes them. This area has a patient restroom, so this is a restroom for the patients. If the other restroom's not available, you can come and use this restroom also. Again, disregard this mess. It's usually much better. Our clinic manager, she usually sits here. Her name is Dawn. We'll probably meet her in a second. And she's the one that takes care of all of this area. She manages the clinic for us. And she's usually sitting here, but she's working in the back. We'll probably catch her on the film in a second. Now I want to show you the server room. Come on this way. Now the server room, you're going to be coming in here quite a bit. And this is where we keep up some of our instrumentation that needs to be brought out for patient care. Come on in. We call it the server room even though the servers are no longer in here. We keep some of our keys in here, the clinic keys. So if you're the crew person, we'll say, go get the keys. So that's where we keep the keys. We have chargers for some of our equipment. I'll open up one of these. This is called a Nomad. And this is the chargers for the Nomad. Here's the chargers. It's kind of like a ray gun. It takes x-rays, you put the handle on it that's been charged, and it's really cool. So you'll all get a chance to use that. So that's for radiography days.
So if you didn't charge it and it doesn't work, you don't get mad.
Yeah, it's like your phone. If you get upset when you go to use it and then it's not charged.
No mad.
We'll sneak around here too. We have a little bit more skulls here. We also have other items here. These have to be pulled out. There's sensors. There's hearing lights. In here, there's instrument packets. There's too much stuff. I can't get to it right now. But we might be asking you to pull some of these things out and bring them to the labs, depending on what we need. All of these items are very expensive. This sensor alone, each one of these is probably like $6,000. Just this one, and we have like 15 of them. So all this equipment is very, very expensive. So we keep it under lock and key. Again, disregard the messiness of this area. It will look much nicer by the time you see it. Okay. Reception door, we're going to go in, we're back to where we started. We did the whole loop. See, here's where another oxygen tank would go. And we're back to this where we started. So I hope you enjoyed the tour.